BC's request for an amendment to their proposal. We have said yes, and it is effective immediately.
What does that mean?
That means that the proposal that was put forward to us by the government of BC to amend the public use consumption under the Section 56, the amendment has been granted.
What lessons will you take from that what lessons will you take from that for other potential applications that go forward on this policy?
So let's be clear, the BC pilot is the only pilot in Canada at this time. We've moved forward with BC on this with a clear lens on public health and public safety, because we know that we need to address the opioid crisis and the overdose deaths that we're seeing as a public health issue. This is a health crisis, not a criminal one. That being said, communities need to be safe. People need to have confidence that in their own communities they can move about freely and feel comfortable and engaged. But we also want to make sure that those who are using drugs also have safety and have healthcare services to support them so that we can save lives.
What's been happening over the past week and a half? Can you tell us more about some of the issues you needed to address before you could say, yes, you can recriminalize public use?
So let's be clear, decriminalization is not the cause of the overdose deaths that we're seeing. It is the illegal toxic drug supply that is killing people. It is a poison supply and it is highly dangerous. Moving forward to any kind of pilot like the one in BC, we know that we have to have a balance. Public safety and public health. That means there needs to be sufficient health services in place, scaled out to meet people where they're at, and also law enforcement to have the tools that they need to ensure that public safety is a priority. And then in the case of public consumption, that there shouldn't be disturbances to the public for those who are going about their daily lives. We want to make sure that we look at this from a human-centered lens, that we are compassionate, that we are collaborative, and that we are working with provincial jurisdictions to ensure that health and safety supports are both in place.
So were there not enough supports in place in the example of BC? Like, to my colleague's question, what lessons can be learned from the fact that 1 year into this, you're already having to make tweaks and amendments and recriminalize in public spaces in certain places?
So we went into this with BC when the proposal went into place last year. We always said from the get-go we would be analyzing, we would be monitoring, we would be assessing as we go along, and also be flexible. This is the first time this has been done in Canada. There are a lot of lessons to be learned. What we know is health supports need to be readily available in a timely manner for those who are seeking help when they're using substances. That being said, BC has committed and continues to grow and scale out their health services, and we're supportive of that.
Do you close the door? Do you close the door to any further decriminalization?
So decriminalization is one tool of many in a suite of tools that we have in the pillars of our policy approach in addressing the opioid crisis. That means we have to look at prevention, we have to look at harm reduction, we have to support treatment, and we also have to make sure law enforcement has the tools that they need to ensure that those who use drugs aren't recriminalized and are directed to safety and health services. And in extreme circumstances where there is a threat or an issue with public safety for those using drugs, that enforcement has the tools that they need.
Does it change anything with Toronto's application?
There's a lot of uncertainty about what the status of Toronto's application is. So have you looked at this Toronto's application?
Toronto Public Health's application has not come to my desk. The last time it was reviewed by Health Canada was in last year. It's been well over 2 years since the initial proposal was put forward. It was insufficient at the time, and it remains just dormant at this time. It's not on my desk.
What was insufficient about it? Can you clarify what was insufficient?
No, I can't go into that.
Why not recriminalize? Sorry, why not recriminalize hard drugs? Full stop.
Hard drugs were not. Let's be clear. Decriminalization did not make cocaine, fentanyl, or methamphetamines legal. The decriminalization pilot was very clear that it was about personal possession of a threshold amount of 2.5 grams for personal use only. This polarization that's been happening and this politicization of the reality that people are dying in our streets from an illegal toxic drug supply, to conflate that with whether these drugs are illegal. They have remained illegal. We have not done. Decriminalization is about ensuring that people don't have to face stigma and actually go to get help. And I really am frustrated that the opposition has made this a dehumanizing debate for those who actually need our help, and that they don't recognize we need a full suite of tools to actually save lives.
Can I go back just to my colleague's question about the time in between BC making this request and you making a decision on the request? What sorts of information were you looking at, reviewing? What was going through your mind when deciding, yes or no on what they were asking?
So it's not a matter of what's going through my mind. It's about what we know we need to do to respond to the opioid crisis and to people dying from the illegal toxic drug supply. So in putting the amendment into effect, we want to make sure that police have direction and clear tools of when they encounter someone who is using drugs in a public space, what direction do they have? They should be directing them to healthcare. They should be directing them to supports and services. And that it's in extreme cases where there is public safety concerns that arrests can be made. We want to make sure that people are getting help. That is the focus of this. So when we sit down and look at a proposal, because we are firm on our policy here, we are firm in how we are moving forward to save lives. And to do that, we have to have a careful, well-thought approach. We understood the urgency of this, but we also don't base our decisions on knee-jerk reactions. We base them on that there's clear direction and clear safety and supports for both communities and those who need help through healthcare.
Minister, why can't you clarify the Toronto application issue? We're seeing a large, very
The
heated public
application is
debate.
not in front of
But
me.
we're asking why
why
was it
can't you
insufficient?
clarify? What's the issue?
It's been a dormant application for close to 2 years.
Was this a failure of the pilot, in your view?
No, absolutely not. We said from the get-go that we would adjust and analyze as we move forward. This is the first time this has been done. As in any pilot, it is a process of learning, taking that learning and adjusting and making sure that we move forward so that we're saving lives.
Do it for future applications, because you say it's dormant. Toronto Public Health is still answering questions about it. They still say it's in the hands of Health Canada. So if you want to clear that up, but does the city need provincial approval to move ahead with the decriminalization pilot?
The Prime Minister's been clear about this. I have been clear about this. We work collaboratively with provincial jurisdictions in addressing the toxic drug supply and the overdose crisis.
Does collaboratively mean you need to have provincial approval in order for a city to pilot?
Collaboratively means that we work with those jurisdictions that are responsible for delivering healthcare services and law enforcement.
Doug Ford said you'd fight the Toronto application like hell. Does Doug Ford's opposition mean that Toronto one won't move forward?
It means that we will continue to work with jurisdictions to explore every tool and every option that we have available to support those who need our help, because this is a health crisis. This is not a criminal issue. Thank you, everyone.
For BC followed with any additional support for British Columbia, for policing or healthcare?